All right. Looks like we are live here. Barbell Medicine YouTube Q&A. Thanks everybody for joining. I think I like this a little bit better than the Instagram thing because it'll be here permanently. You guys will be able to mine this stuff for answers to your questions. So I really appreciate everybody joining. I need you guys to let me know if there's any problems with the echo on this thing so I can try to fix that this time. In any event, thanks again for joining us here Sunday evening. So, and then I'll just do a little PSA first. Barbell Medicine, we have our Gains RX supplement line, the Gains RX peri-workout supplement, and also the whey protein. Both are available for sale. The whey protein is actually on sale right now, so you guys check out the barbellmedicine.com website for that. Also, all of our articles, podcasts, videos, everything's up on the website. So if you haven't been over there, check it out. All right, so we've already got some comments here on the stream, and we will go through them. Let me know, again, if you got any problems with the echo. And looks like we have an echo, so let me see if I can take care of that here. Let's see. Sounds like there's a slight echo. Well, dang it. Let's see. Hmm. What if I do this? Is the echo better? Is any? Is the echo any better? Maybe a little better. We'll see if this works. I really wish that this was good. Yep, just started here. Not sure if the echo is still going on. We'll see if we can move this. All right, so William Walker, Dr. Feigenbaum, I am 6 weeks into my novice LP and I have begun passing kidney stones. Now my urologist wants me on a low animal protein diet. Your thoughts? So my thoughts are that you should probably listen to your urologist on this. I don't think that we have good evidence. Well, and it depends on the type of kidney stones and your medical history and a bunch of other stuff. It's not typical that people have kidney stones after starting training or even a high protein diet. Unless you have something else going on. So I don't really know if I can advise you specifically there because there are a lot of potential confounding factors. So I would follow your urologist's advice for now and get rid of the kidney stones, and then we can reevaluate. Handles 1. Thoughts on power cleans for a novice. I do them when I'm not deadlifting on a particular day. Should I do them when I'm not deadlifting on a particular day, or should I be doing a deadlift variation? I don't believe I saw any in the bridge. So if you're a novice, I would recommend learning the power clean. If you're going to coach people, I also recommend that in addition to learning the power clean, you learn how to do the power snatch. Because effectively, if you're going to be a coach, you need to know how to do the lifts and have actually performed them. So I would recommend doing both. If you're a coach, you would only involve the power snatch after the novice progression. So back to the novice progression, you should learn how to do the power clean, and once you get to the intermediate phase, you get to pick if you want to continue doing the power clean. We didn't put any in the bridge because most people don't do the power clean in general, and for just a strength-based sort of program, we kind of assumed that people would get more mileage out of a deadlift variation. But if you're a novice, by definition, you don't need deadlift variations and all this volume and this, that, and the other, so you should learn how to power clean. Let's see. Andrew Terrence. Can I do power cleans on the bridge? Yes. You can replace the row, which is on day 2, with the power clean. However, the volume and intensity is going to have to be modulated in a more complex fashion than just 5 sets of 3. So that's why we didn't put it in, because generally when you're having somebody do a lot of Olympic lifting or power cleans, then you have to do more complex loading schemes, and we felt like that wasn't really appropriate for the bridge. Let's see. Emmanuel. Jordan, I'm plateauing in bench press. I increase my volume, doing 164 reps weekly, including overhead press, dumbbell, and landmine press. Do I think that variation is garbage and the volume must come from more sets of bench press and overhead press? In general, yes, I do. And it also depends on the intensity of what you're doing. However, I don't think the landmine press is useful at all for building strength. I think for somebody who plateaued on their bench press initially after like a novice or early intermediate program, that adding a bunch of dumbbell work is going to work either. You know, so that's just my take on it. I think if you want your bench press and overhead press to go up, then you need variations similar to the bench press and overhead press to make it go up. You can make a case, even if we're just doing more of the bench press and overhead press and still getting good results out of that. Junior, or JR, either way, asks, Dr. Feigenbaum, I have been doing strength for 2 months and have noticed a perceived increase in testosterone. I feel great and I'm getting strong, but I believe my testicles are shrinking. Advice. I'm not sure how your testicles would actually shrink from producing more testosterone. It's actually the opposite case for what you would see. If you were taking exogenous testosterone, then your testes actually stop producing testosterone, which is why they atrophy. So, because the stuff within the structures within the testicles no longer are needed. So, if you were making more testosterone, they would actually get bigger. I mean, you could make that argument. David DeNicola asks, how much time should you leave between a meal and training? 3 hours, question mark? Also, should you still wait 3 hours after your post-workout meal if it consists of whey, protein, and dextrose? Thank you. I find that most people do best with about 2 hours between eating and then getting their training in. And then whatever, 3 to 5 hours after your pre-workout meal, you should eat again, which would then be your post-workout meal. And then, yes, you should wait 3 to 5 hours after your post-workout meal, even if it is whey protein and dextrose. David Perkins asks, guitar influences / when are you going to release an album with Rip guest starring on the trumpet? That's actually funny. Yeah, so the first stuff I'm learning is Pearl Jam and some Band of Forces, just because I like them and that keeps it fun for me. And yeah, if I ever get good enough where I can, write something. I know how to read music. I don't know how to write music. I mean, I guess technically they're not the same. But yeah, could get Rip on there, blowing a horn. That'd be funny. Thoughts on shoulder rehab post-op? Blair Mitchell asks. That depends on the shoulder surgery, right? Because labral repair, for instance, is not the same as rotator cuff repair. When is Baraki going to host? Yeah, so we're going to patch Baraki in tonight, but he's having a dinner with some of his clients out in Virginia right now. So we'll get him on here, have him hosting or co-starring. Red Knocked asks, hammer curls for bench press, question mark? I don't think that you're going to get much improvement in your bench press, if any, from doing hammer curls. Joel Schneider, I have serious depression and this isn't a joke. Someone help me. Hey, want to be serious about this? If you need to talk to somebody, there are hotlines that you can call. And you should reach out to a friend. And if all else fails, you should go to the emergency room. So, Corey Lambrecht, also interested in the shrinking testicle question. Well, there you guys go. It's just basic human physiology, folks. Joel Schneider. Let's see. Yeah, Joel, you might need to seek some medical attention, my friend. Shane McGee tells me it's a little echoey. I want to try to work on it, man. Yeah, I don't know. I wonder what this thing is. I wish I could figure out the echo, Like, is that better? Not sure. Lenin D'Souza. Hey, Dr. Jordan, great fan of your talk at university. Great talk at a university on barbell training. In that talk, you recommend 20 minutes of high-intensity interval training. How do you do it with an assault bike? You should sprint 20 to 30 seconds on the assault bike, then rest for a minute and a half, a minute 40, and then do it again. That's how I would do it on an assault bike. Body of Knowledge 77. Your thoughts on the enjoyment and compliance links/factors related to training? Yeah, I think that seeing progress and having some enjoyable factors within your training likely will improve compliance. That being said, this is kind of like a deferred payoff sort of thing. So I think you need to have some easy wins, which is why the novice progression is so addictive. And then I think once you get training becomes part of your life, you can do with the deferred payoff. You can tolerate that a little bit better. Daniel Baker, have you ever heard of the supplement drug LDG4033? Yes, I have. It is a SARM, although I believe that's the one that's not actually a SARM. I think that people probably shouldn't take it. We don't have good evidence that it works, that it's safe long term. Certainly nothing longer than 20 weeks. And I think that, and it's on the banned substance list as well. So those are my thoughts on it. Kyle Snyder. Let's see. Is consuming added sugar as big of a deal from a health standpoint as people say it is? Depends what people you're talking about, because some people will say, it's like doing heroin or smoking cigarettes and stuff like that, which is not necessarily the case. The evidence doesn't really bear that out. It really depends on the entire diet, so I wouldn't try to demonize one particular part of the diet, particularly, and especially not, carbohydrate intake and as a byproduct some sugar intake. So, yeah, it depends. Mr. Dynasty or D Nasty. Hopefully it's Dynasty. Hey Jordan, what's the biggest issue you have with physical therapists? That they do not, their rehab much of the time does not comport with stress recovery adaptation. And people are using TheraBands and dumbbells and other like little pink dumbbells. No offense to the color pink. I like pink, which is fine. And that the patients ultimately are not doing any better than they would do on their own. So if that's the case, then why pay all the money for physical therapy? And you don't learn how to train in physical therapy school. And they, some people would regard them as the experts on like physical activity, performance, stuff like that. But there's no training for that. Chill out, dude. How many times can I repeat the bridge? There's really no answer to that because it depends. As long as you're still responding to the stimulus, you could repeat it indefinitely. I would expect somebody to start the stimulus to become stale after 2 or 3 times through it without changing changes. Surprisingly roomy. Has pain in his left hip. Feels similar to hip flexor pain you get from a lot of running from sports, but is not that. Started after feeling a pop at the bottom of your squat. Yeah, unfortunately, I can't diagnose that from here. It is likely nothing. And I think the best thing you can do is adjust your stance width and toe angle and make sure that your squat technique is good. And you should probably limit running, any sort of bounding exercises for a while. You may have to adjust your squat frequency to let this thing clear up. But it's likely nothing. And even if it is something, it's likely something that will go away and will just be an artifact in the future. Super Jonathan Harris. Hey, doctor. Good evening. Lifting more frequently. Hang on a sec. Hey, doctor. Good evening. Lifting more frequently, 3 to 4 weeks, causes your hair to fall out faster. How do you stop this? Lifting more frequently is not making your hair fall out faster. There's just no physiological mechanism by which that could occur. So, Neil Snedencrest, do you have a stock fiber intake recommendation? Yeah, about 35 grams per day. Jonathan Ben, have you reconsidered your stance on carrot cake? I actually hate carrot cake. I really dislike it. I'm not a fan. Red Knocked. Having a novice do barbell rows for 3 sets of 6. You could do that. I don't necessarily think that barbell rows need to be a part of an early novices program. But if I was going to program them in, I'd probably do them for 3 sets of 8. And I have no real reason to do that other than that's what I do normally. Alan Doss. A squat, bench press, deadlift Monday, Wednesday, Friday for 3 sets of 4 to 5 reps each. And you're increasing the weights weekly. Your bench is stuck at 135 for 3x3 for 3 weeks. Yeah, it sounds like you're not doing any particular program that I would recommend. And if you're benching 135 for 3 sets of 3, I'd want to know your body weight. So I think you should do the starting strength novice linear progression and start over. Let's see. Let's see. Jordan, it seems like your software is picking up the audio. Your PC is playing out of the speakers as well as my microphone. There's, yeah, so it's on mute. I don't know, man. I need to go back to school for audio-visual stuff. I'm not sure. Jack Maloney asks, how much does alcohol affect the strength gaining process? Well, it depends how much alcohol you drink. You know, it's definitely a dose-dependent kind of thing here. So if you drink a lot, very, very frequently, then, you know, it may compromise your results quite a bit. My stance is, you know, if you're drinking enough to get drunk, you're drinking enough to inhibit your progress. So, Robbie Davenport, I'm 6'2", 205. When should I end GOMAD? You could end GOMAD right now and switch to macro tracking. They're not; those things aren't mutually exclusive, so you could do both. You're just trying to control for overall calorie intake. Let's see. How to make egg whites not taste like crap. I like to cook them in bacon fat and then put hot sauce on them. And how is the easiest, best way to prep chicken and red meat? It depends on what you have available to you. You could argue that barbecuing is super easy because you can do that en masse, or you could do it. You could broil them. You could bake them because you can bake a lot of stuff. You could boil a lot of stuff at the same time too. So, yeah. Doug Auerbach's Plexus. Consider muting or reducing the volume on your speakers or using headphones to monitor. Ooh. Hey, the echo's gone. I have no idea what happened. Something happened, and it's good. So, sorry, guys. Let's see, Christian, you missed us last time. When will we be back to San Antonio, Texas? Probably next year. Yeah. Girls, I have no idea how to say this whole name. You did a jump of 25 pounds just to see if you could on squats, 250, 275 during your LP. You had no trouble. Why is it recommended to do 5 to 10 pounds? So that's just a stock kind of recommendation. You can take bigger jumps occasionally, but the thing is, if you miss your jump the next time, then should you have taken a 25-pound jump? The idea isn't to grind out all of your reps. That's a bad way to go about your training. It just limits your development long-term as a lifter. Nathan Rafuse. Opinions on ashwagandha. Doesn't reduce your stress. It's got some evidence that it may work, but I don't think it's particularly good evidence. I wouldn't recommend it. Andrew. Just the Andrew. Do you have any recommendations for someone who has difficulty finding and getting into a low bar position in the squat? That they should just squat more because it's going to get easier over time. I mean, I still have a little bit of difficulty when I'm cold getting under the bar. So sometimes it never goes away. Sometimes, you know, anatomical, and other times it gets better as you squat more. So. Nicholas R. My knee clicks when it extends sometimes. It also feels like the bubbles under the kneecap. Should you be concerned? Nope. Nope. That's good, right? It's good news. Diego Sanchez. As an early intermediate with 45 pounds to lose, should you be more concerned with losing fat slowly and keeping strength or having a large caloric deficit? Oh no. Oh no, what happened? Looks like we're back online here. Not sure what happened there. Let's see. I don't think that you should just try to cut a bunch of weight. Like, I think that's probably badness, unless you have to do it for a job or something like that. I think that if you cut a bunch of weight and lose a bunch of strength, that's probably a net negative versus cutting a little bit of weight and maintaining your strength or improving your strength, which I think is easily doable as an early intermediate. Let's see. Sizzle Tang, front shoulder, dull pain 1 day after horizontal pressing only, no pain in vertical press. Why? I'm not sure. It may not be anything. Sometimes your shoulders are going to hurt. It just depends. If it's super, if it stings, if it's sharp, if it's really, really bad and you can't horizontal press anymore, then you could just do a couple weeks of press only. Or you can just go back, act like nothing happened. Kyle Henry, audio is effed. Well, hopefully it's a little better now. Carla, I don't know you, but a kissy face seems cool. Thank you. William Walker, my left leg is 3 inches smaller than my right from spending last summer in a wheelchair from a motocross accident. Will Novice LP help this out? To the extent that it can be fixed, yes. I wouldn't do any unilateral work because everyone's imbalanced. The goal is to move better, be stronger, live longer, live a more productive life, right? So I wouldn't do any unilateral work because it's not going to help you do any of that stuff any better than just doing squats and deadlifts. So, Joel Schneider, also, what other websites and resources should I look at for programming, having already read Practical Programming and starting strength and visiting ours and RIP's website consistently? So I think once you've read Practical Programming enough times to really understand it, then you'll have come across other books on programming. But if I tell you to go read Bondarchuk, or if I tell you to go read Zepfiorsky, I think I've just done a disservice to you. Aiden, personally, do you manage the 3 to 5 hour refractory period in the context of my social life? I.e., do you go out to eat or drink in between meals? No. I mean, it's like if I'm going to go eat dinner, I've got, 3 hours is gone since I've eaten my last meal. Woo. Let's see. Adam, 6'2", 295-pound male, 35 years old. MyFitnessPal recommends 2,800 calories, lose 1 pound per week. Seems a little low. To be obese recommends about 3,400. If you haven't been losing weight on 2,800 calories and you're accurately tracking, then you should decrease your calories. But if you're not accurately tracking, then maybe your calories aren't really 2,800 and you should reduce anyway with the idea that you have some imprecision in your measurement and you're okay with that. Hey, Jordaddy. I'm a 5'11", 182-pound male. I'm having issues improving my 180-pound bench and 115-pound overhead press. You're currently gaining weight. You feel recovered. Is it too early to do the bridge? Well, if you're stalling, no. If you're not stalling, yes. That's kind of like the test there. Ozan, I can't buy a proper belt right now. Should I switch the intermediate programming after novice LP stops? Well, you should switch the intermediate program after novice LP stops anyway. And you should buy a belt when you can. Legends never die. That's true. If I follow your 5-step deadlift plan, my hips end up almost as high as your shoulders. I have a long torso, short arms, and femurs. Would it be appropriate to do sumo? If your anthropometry is correct, as you describe it, then you would actually have a pretty vertical torso, relatively. But most people's hips are near, they're a little lower than their shoulders, but not by a ton. But if you actually do have short femurs and a long torso, then yours would be substantially lower than other people's. So to answer your question, no, I don't think sumo is necessarily indicated for you. Sounds to me, if your technique is good, then just keep pulling conventional. Are there any significant disadvantages to squatting and deadlifting if you have flat feet? No, not outside of just having flat feet. And the other thing is, what are you gonna do? Not train? Yeah. So, will creatine cause hair loss? There's a paper that shows that creatine may increase DHT levels in some folks, and if you have male pattern baldness, that sort of genetic component, maybe it accelerates it, but I don't think the data is terribly good for this, to be honest. 1 kilo increments are small enough for linear progression on press. I think so, yeah. Paid round. My right quad, hamstring, calf, glute are smaller, weaker than your left as a result of atrophy post ACL surgery. How can you correct this while on novice LP? Squat and deadlift. There you go. Sarah Brady, what's up? I've heard you advise men to gain weight according to height and age ratios for strength. I've definitely never done that. And I'm not trying to be a jerk. I just don't use the height and age ratios for strength at all. And for women, I've said that the weight gain is going to be dependent on what they weigh right now, how tall they are, their personal goals. In addition, the rate of weight gain is going to depend on where they're at on that athletic continuum, right? So for females, it's super athletic. So narrow waist, broad shoulders, lots of lean body mass, respond super well to training. I probably would not switch them to triples on the novice LP, and I would probably have them gain weight a little more aggressively if they were underweight. Too bad about the carrot cake. We could have been friends. I just don't like carrot cake, man. Sorry. Robbie Backus. What do you recommend for an early intermediate for 3 days per week programming with the goals of strength lifting meets? Yeah, I would probably just do the bridge and then press twice a week and bench once per week. Chris Zaniga. In the advanced novice starting strength program, I assume, what would you replace the power clean with? I wouldn't. I would just do power cleans. Thoughts on steroids? It's a little too broad, Thoughts on if they should be illegal? I probably don't think so. They certainly should be scheduled how they are. They're used heavily in sport. I think drug testing is hilarious and ultimately has not done a good job at preventing people from using. I think that once the incentive is high enough for people to use performance-enhancing drugs, which is a pretty low barrier, to be honest, then at that point you have to say, well, our drug testing is not going to work, and we should just allow everything. I'm just saying it's a slippery slope. It does stop somewhere, and I just wouldn't. I wouldn't waste the resources for testing, to be honest. And who's to say what's fair and what's unfair? I can't. So, if you're gonna play a sport that has a certain set of rules, and you're agreeing to play by those rules, well, all right. But I think there's a lot of shades of gray in there. So I don't really have a firm opinion either way on anabolics. Nicholas Devlin. If you're waiting 3 to 5 hours since your last meal that generated a muscle protein synthesis response, will eating something before then push back the time window until you can do it again? Yes. Malcolm Collins. Reasons to use knee sleeves / wraps and weightlifting belts. Knee sleeves, if you have knee pain, there's evidence that shows it decreases knee pain scores. Knee wraps, you would use them. If you're going to compete in a meet where you use knee wraps, weightlifting belts allow you to use more weight, allow you to use your trunk musculature to a higher degree, recruit more motor units, lift more weight, increases your training stress. So all those reasons and more. Should grip width variation, Cody Wallace asks, be part of the novice LP? No. For a novice, that does not represent a useful training stimulus. Maybe later on, sure, but not in the novice progression. Let's see. Thoughts on Juggernaut's Scientific Principles of Strength Training? I haven't read it. So I did just do a podcast with them, so that should be coming out. man, a lot of questions. Here we go. I like lost my place. Oh, here we go. Daniel Baker, is lighter weight the only thing I can do when knees are coming together when starting out the squat? I think that's what you're asking me. Yeah, unless you can cue yourself to push your knees out, and that fixes the knee problem. Red Knocked. Alan Doss, run, start regular starting strength. You should have stalled at 135. I kind of agree with you there. Yeah. Mr. D. Nasty, in the acute phase, do you feel that evidence supports a method other than typically used by PT? Let's say we have a patient complaining of shoulder pain due to some tendinopathy, PT versus rest activity mod. So we have evidence that PT doesn't do, the acute phase of chronic shoulder pain. So PT, unless they're going to prescribe activity modification that revolves around training, isn't going to help. It's going to cost money, and they're going to tell the guy not to train. So, and since they don't know how to train, I don't know what they're doing. Can linear progression versus periodization be explained in a simple way? Linear progression is a type of periodization. Hey, there we go. We did it simply in a non-nuanced fashion. Michael Hepburn, favorite vegetarian foods for gains? All the ones that are animal derived that you're okay with eating. Yeah. 5 egg whites with 2 whole eggs is not bad. I agree, Sean. I agree. Mike Jones, any exercises I can do to get better at the conventional deadlift starting position? Not besides doing conventional deadlifts, because it's very specific. You're actually practicing doing the deadlift. That's what you should do. Yeah. Yep. So you may just require some more exposures to it to make it a little easier for you to do that. What is your opinion on doing both the bench press and press twice a week in a 4-day novice LP? Well, there is no 4-day novice LP, and I wouldn't do both twice per week. I think that the overall pressing volume, total pressing, so that includes the bench and the regular press, is a little too high. So I wouldn't do that. The Masterful Creator. How would your final week recommendations on meet week for an early intermediate change if it's deadlift only meet? I probably wouldn't squat on Monday. I would pull up until the last warm up on Monday. On Wednesday, I would pull just a single at like the second to last warm up. If that like on a Wednesday or Thursday. If Wednesday, I have to meet Saturday, and then Saturday I would go pull. If you really wanted to peak for it. Darkest Hydronoid. What is my take on how to fix anterior pelvic tilt in a novice? I wouldn't fix it. Besides having them stand up straight and contract their abs and squat and deadlift. That's what I would have them do. When do you guys think we will make it to Orlando? I'm not sure. Yeah, I don't know. Broken Stitch. Can you talk a little bit about the rest time between sets? How does someone know when they've been waiting long enough? Yeah, so I just typically tell people 5 minutes between work sets. And if you're an intermediate or if you're using RPE, sets of like RPE 7 or higher, set your clock for 5 minutes, time it, go. I wouldn't wait any longer than that unless you're testing singles. You can go up to like 8 minutes, 10 minutes, but I probably wouldn't wait 8 to 10 minutes during regular training for like sets of 5. Connor Lyons asks, Jordan, any advice for a lifter with a reaction to barbell chalk because of a nickel allergy? There's nickel in chalk? In barbells? I didn't know that there was. I guess there is some nickel content in barbells. Wonder if that's all bars. What if it's stainless steel? What if it's stainless steel, a stainless steel barbell? You still get a nickel reaction to that? I don't know. Chalk-wise, I thought it was just magnesium carbonate. Is there nickel in that? If all that has nickel in it, then yeah, I guess you can use gloves. Kyle Snyder, when you refer to a healthy male having a waist under 40 inches, where are you exactly measuring? Around the umbilicus or the belly button or the navel? Yes. Robbie Hoffman, do I subscribe to the Dollar Shave Club? No. I like bougie razors, man, you know? Ross, how would you structure training after novice LP for one who practices a sport activity, yours being parkour, has no on-off seasons? Right, because you were practicing once, sometimes twice per week, or on weekends only. Yeah, I would just have them do the bridge. I wouldn't do any specific modification for that because it's a light practice and competition schedule. Wilbur, hey, you're welcome, man. Here to answer the questions. Doc, is Rip ever going to send some emissaries outside of the United States? Emissaries? Well, we've been to Australia and Europe, and Carl is in UK, and then Joe and Reese are both down in Sydney. So we're getting out there. Cody Dodd, have you ever encountered a scenario where you had to stop increasing carbs for an athlete to avoid hyperinsulinemia for optimal weight gain? No. Nope, haven't. And if so, would increasing your monounsaturated fats or protein? Yeah, so hyperinsulinemia is a pathological response due to insulin resistance. This is not something that occurs normally. And so if someone has evidence of hyperinsulinemia, so waist, circumference is going wildly up, blood pressure is poorly managed, it's usually not in a weight gain situation, right? And if that suddenly occurred, then I would back down their calories so that they would lose weight, and we would try to fix that. But it's never happened where I've been adding calories. And further, I wouldn't just think that adding fats would be a better situation. They would need to lose weight, not necessarily lower just carbohydrates, and continue to gain weight. Just give me a username. Thoughts on keto, vegan, intermittent fasting for running Texas Method 531 hybrid? That's pretty good. That one dude 7. What do you do at the end of a program? I mean, you have to figure out what you want to do next, right? So you're at the end of Lane Norton's PH3 program. You have a meet coming this weekend. Yeah, so what do you want to do? Usually just roll. I mean, usually one program develops you for the next program, so that's why it's nice having a coach sometimes. Is it possible to modify the starting strength program for powerlifting? No. I mean, everything's possible, but you wouldn't, because the person who's a novice is not a competitive powerlifter by definition. They're a novice. They're untrained. And they can't make progress any faster by replacing exercises. When you're an intermediate, yes, you can specialize towards powerlifting, but as a novice, no. Bench pressing more, for instance, is only going to minutely improve your bench press as a novice, because you're benching enough to effectively maximize your improvement. Wilbur, what is the best way to strengthen the VMO and prevent knee clicking when squatting? Well, the VMO doesn't exist as an actual muscle. The best way to strengthen your VMO is to just get stronger, squat more, and knee clicking is not pathological. So if it's catching, that's a situation. But what are some pros and cons of hiring services from Barbell Medicine versus just buying the templates? Well, so you get individual adjustment and prescription and constant feedback, updates, coaching on the lifts, accountability to check in. So yeah, they're very, very different. Cons would be it costs more. So there's that. How to break pressing plateau in Texas Method? Well, I would stop doing Texas Method because it doesn't represent enough volume at the correct intensity to improve your press. David Enix, advice for stopping the bar from spinning down your back in a low bar squat, keeping your wrists in slight extension, elbows are relatively parallel to torso during movement. Yeah, so use chalk, use a thick cotton shirt, make sure the bar is not too low. In general, if it's rolling down your back, it's probably a little too low in general. Mike Jones asks, thoughts on Juggernaut Scientific Principles of Strength Training? I haven't read it, so I don't know. How to balance training with a physically demanding job? Yeah, so if you've been doing the job long enough, it's no longer physically challenging, unless your work requirements acutely go up. So, I mean, I think in the summer it's very difficult, but, the mailman who walks 50,000 steps a day gets used to that eventually and can just train productively. So, why do I have a shirt on? For the good of the internet. Juan Fernandez. Experience some knee discomfort throughout the day that completely goes away after warming up with just the barbell. That's good. Don't do anything about it. Keep training. Austin Burnett. Any recommendations after completing the bridge? You could run it again. Yep. If recovery, Caddis Nedden asks, if recovery would be compromised for a novice, should intermediate program work well? Not necessarily. I think recovery is always compromised as a humanoid. So just, you know, do your best. Girls, girl, what, girl, Girl Scouts with knit. I have no idea, dude. Presses before squats. If squats cause previous bicep injury to become irritated during, you can do that, or you can put the bar in the high bar position and make that bicep pain go away for good. I wouldn't always press before squats. How do you program alcohol into your diet? 1 to 2 drinks tops, and I count them. I count the calories and then subtract those either from my fats or my carbs. Usually my carbs. But been doing 5-3-1 for a few months. Should you still start the novice? Yes, do it. Sean Sanson, how do you convince people to not add cardio to the LP when they definitely aren't overweight? Well, if they're asking my opinion and they trust it on some level, then usually they'll just listen to me. But if they didn't ask, they'll never trust me. So, yeah. Sarah Brady, can you elaborate on the VMO not existing? Where did that go? Dang, he's like way up here. Did I mess this? Oh. Can you elaborate on the VMO not existing? You had a lateral release and the VMO advancement to the correct VMO advancement to correct maltracking. You feel like you've been lied to. Yeah, so the VMO, vastus medialis obliquus, it's the distal end of the vastus medialis muscle. These are oblique fibers running at, I believe, up to 54 degrees angle at their most distal insertion. In the 60s, there were 4 amputated legs that some physical therapists said, hey, there's these muscle belly at the end of the vastus medialis that runs obliquely. We should call it the VMO. However, it doesn't have its own innervation, doesn't have its own action, muscular action. It doesn't have its own antagonist. Although later in the 70s, some folks did try to say that there was a oblique region to the vastus lateralis, which basically was the antagonist to the vastus medialis obliquus. And so they actually wanted to rename the quadriceps the sexticeps, because then there were going to be 6 muscles instead of 4. But Nomina Anatomica, which is now Terminologia Anatomica, said, nay, we can't do that. Yeah, so it doesn't have its own nerve supply, no epimysium, no specific action, no antagonist, and so it doesn't meet criteria for a muscle. The only thing it's useful for is for knee amputation and knee replacement. So, all right. Hey Jordan, at what point would you change your program from novice to intermediate? Is 225, 315, 405 a good standard? So I wouldn't use weights. I would use the ability to adapt to the given stimulus stopped. If so, then you effectively have ruled yourself into needing a new program. Dave Nicola, if running the bridge twice in a row, should you skip the first week of the program? Yes, I would. All right, last question, because I know it's going to keep this at 45 minutes. Kevin Logan, every other day versus Monday, Wednesday, Friday for novice LP. Yeah, I would do Monday, Wednesday, Friday and preserve the 2 days off in between Friday and Monday. It's a nice way to dissipate some fatigue and make sure the progression keeps going. But in general, training versus not training, if you were going to miss a session, you can do days back to back if you have to. That's not ideal. Okay, so hey, thanks for joining us on this YouTube Live. We've been here for 45 minutes. I appreciate it. I promise I'm going to get this audio thing figured out. I don't know what the deal is, but we'll work on it. And we'll catch you guys next time. Thanks for watching.